Time has concluded. I call the member for Mallee.
Thank you, Mr Speaker. My question is to the Minister for Regional Health. Will the Minister please update the House on actions the Morrison-Joyce government is taking to protect regional, rural and remote Australians during the COVID-19 pandemic?
The Minister for Regional Health.
Thank you, Mr Speaker. I'd first like to compliment the member for Mallee for her fierce campaigning and advocacy for her cross-border communities to make sure they don't get caught in the COVID crossfire and make sure they got the access to the medical services across the river or across the border that they deserve. Please be reassured that we are vaccinating in record levels around rural, regional and remote Australia. That is why, in the last week's figures, 493,000, almost 500,000 of those 1.9 million doses were delivered in that out of the metro regions in Australia. It's constantly being calibrated and recalibrated and adjusted so that we get more points of care, more points of vaccination, more point-of-care testing around regional Australia. In the member for Mallee's electorate, she'll be reassured. She's there on the ground. She probably knows this, but just to illustrate the point, there's 10 general practices in her hometown. There's 5 community pharmacies. There's 1 Aboriginal medical service, and there's 1 Commonwealth vaccination centre. And the Royal Flying Doctor Service has brought forward their latest visit this week, not only into the Mallee, but up near the Queensland border, down on the coast, just yesterday and today at Wreck Bay. I would like to compliment Flying Doctor. They have turned up again, and I want to give a big shout out to one of their nurses, Kellyanne Johnson, who's Indigenous, is from the Jervis Bay area, and they were running a huge clinic in Wreck Bay. And the oldest recipient was an 88-year-old Indigenous lady, and the youngest was a 12-year-old boy. And one of the local leaders said Kellyanne is an inspiration, and now all the little kids say they want to be a flying doctor nurse too. So thank you, Kellyanne. But seriously, that lattice work of community-based primary care vaccination sites is why this ramp-up is working in regional Australia. If you look at the national figures, in the metro districts and outer metro, the vaccination rate last week at the finalisation figures was 58%. Just across the border, in rural and regional Australia, it was 57%. So we're matching the metro rollout. There are some waves where we're a bit behind, but we're catching up rapidly. And in the remote part of Australia, we have got extra support through the ADF and through the Oz medical assistance teams. Rural Australia not only generates the wealth of the country, it's also the playground of the city folk, and we are working to make sure regional, rural and remote Australia reaches the 70% and reaches the 80% at the same time, so we can all get going and get our life back. We have a plan that's being delivered.